Okay, this is a good one for you this time. NHS waiting lists could be reduced at the stroke of a pen. Believe that one? This is with nobody losing out. It needs no additional staff, no new training, no new equipment, and it could be done within a week, maybe. All it requires is a change in one NHS policy. Okay, what's this all about? Well, let's say, for example, you have a chronic long-term condition. It's going to be with you for life, but it's perfectly treatable. It's not curable, but it's perfectly treatable. And you could be treated into remission where you're living your life as normal until maybe it relapses again and you need the treatment again. But here's the thing. You, to effectively and efficiently be treated, you need to be seen by a specialist, a consultant that specialises in your condition. Maybe as part of a specialist clinic for your condition. Unfortunately, your local health board area doesn't have that specialism. Now, your GP may know that in an adjacent health board area there is a specialist clinic just made for the condition you've got. But here's the problem. He's not permitted to refer you out of area. It's not allowed. He has to refer you to the local consultant that he knows doesn't have experience in effectively and efficiently treating the condition that you've got. There's no option. Let's have a closer look. Your GP at your local health centre has to refer you to the consultant at your local hospital in your local health board area, even although your GP knows that there's no specialist knowledge for the condition you've got at that health board area. So he creates the referral and pops you on the waiting list to see a consultant that doesn't have experience treating the condition you've got. That is a waiting list position that someone else could use. Now, I'm not saying the consultant's no good. The consultant just doesn't have knowledge in the condition that you have. But he probably has knowledge in lots of other conditions that are relevant to his specialism. Other conditions that other people may have, but they're not going to get to see this consultant until you've been seen because you're on the waiting list before them. So you sit on the waiting list and eventually you're seen after many, many months. You're seen by this consultant that doesn't have the experience in treating your condition. Now he's going to have a go, give it a bash. What's the worst that could happen? So anyway, so when this consultant is having a go, doing their best to find a treatment for you, and you can see it's not going well, you can try your hardest to persuade them. You can maybe beg to be seen in the other hospital, the adjacent health board area, where they've got a specialist clinic for your condition. You may show them technical papers that demonstrate how well this other hospital, this other health board area has done at treating the condition you have. And if you're persistent enough, the local consultant may just decide, yeah, okay, I'll create an out-of-area referral for you, because they're allowed to do that. But that means you're on another waiting list to see the out-of-area consultant. That's 2 waiting lists that you've been on, using up a position that someone else could have had. Instead of your GP being allowed to refer you directly to the specialist centre that does treat your condition. This is what we should have. If it's relevant, if your GP knows the condition you have and knows there is specialist treatment available out of area, he should be allowed to do that. And the thing is, when I originally created this, I thought the problem was just in NHS Forth Valley. I thought it was just a policy in NHS Forth Valley. And when the the board eventually did get round to answering my letters, they were quite keen to point out, no, it's not NHS Forth Valley. It's NHS Scotland that has this policy. They may have said it's NHS, the whole of NHS has this policy, but I know that NHS England doesn't have this, but in England, you are able to be referred to any health board area. This is that is a policy that NHS Scotland needs to adopt. And before they start saying, "Oh no, but we," am I wrong? This would reduce waiting lists at the stroke of a pen. Nobody would be losing out. In fact, people would be gaining. It needs no additional staff. The staff are already there. They're in place. It needs no new training, no new equipment. The training that the staff have already received and the equipment that's already there, that's sufficient. That works. Could it be done within a week? Your GP is not permitted to create an out-of-area referral. The consultant in your local in your local hospital is. Let's change that policy so that your GP could directly refer. How long does it take to do that? And it just requires that one policy to be changed. So, in the lead up to May 2026, Scottish Parliament elections, when you have your MSP knocking on the door asking you for your support, saying they're going to make improvements to NHS waiting lists and the likes. Tell them about this. Thanks for listening. Until the next one.